Big farmers are rich and powerful, true. Is that enough reason to vilify them? The main concern is how people use conspiracies against pharmaceuticals to damage health security. I won't pretend to know the guiding principles or operations of big farmers. However, I can explain my analytical process. Big farmers produce variety of medicines. It is hypocritical for anyone chronically, for example, on antihypertensive or anti-diabetic, produced by the same big farmers to discourage vaccination. Which is easier? Sneaking whatever, birth control, microchips, into existing medications which only go through routine checks, or introduce them into new vaccines, which go in through rigorous scientific scrutiny and regulatory checks. Let's think about this. Persons and organizations have different outlooks to life. The news of a natural disaster, for example, an earthquake, will trigger worry in some about the victims. Oh, let's send some support, let's send flowers. Others see business opportunities. I can supply food or water to make money. With disease outbreaks, no doubt, some contemplate developing products for profit. Now, will you say that the group that thought of supplying food and water after the earthquake caused the earthquake? Persons read newspapers or watch movies and conclude on causation. Here's a short science lecture to provide insights on the rigorous processes undertaken before causation is inferred in medicine or public health. I'm quoting the Oxford textbook of public health. It says, starting in childhood, people acquire a notion of cause and effect that is based on observation on one event, always following another event. Children observe that flipping a switch consistently results in the light going on. Maybe not in Nigeria, and readily assign a cause and effect interpretation to these relations. Nonetheless, such naive equation of variation in tandem with causation will too often conflate causation with mere association. To infer causation in medicine public health, as I mentioned, we use widely what we call the Sir Austin Bradford Hill's considerations, which are widely adopted but not sacrosanct. Strength of association, consistency, specificity, which means if you remove that item, will that thing still occur? Temporality, biologic gradient, plausibility, coherence, experimental evidence. Can you repeat it 100 times? An analogy. Please, next time, research and understand these considerations before jumping into conclusions that mislead and harm people's health. What's the practical way forward? Demand that your government put in place systems that ensure foul play is detected and dealt with. Let's make it make sense, not just with farmers. This is just one of them. But whenever you hear a conspiracy, respect the science. It's not about one bad expert.